So we are now broadcasting here. It's about 2 minutes to 11. So Hester, let's just let a few people fill in. I see we've got 2 attendees so far. Hello, Juliette. Hello, Marilene, Ezekiel, Martin Ruiz, Rob Allen. We've got 11 of so far. Danny Lutsky, welcome. Alan, welcome. Greg Perry, welcome. We've got 16, 17, 18 people with us so far. Hello, Michelle Cronier. Welcome, everybody. My name is Mark Lotter, Marketing Manager at CIFSA, and we have the great pleasure in introducing Agile Business Integration Solutions today. Hester will be talking to us about COVID-19 reporting to the National Institute of Occupational Health. And she's prepared quite a comprehensive presentation for us today. I'm quite looking forward to it. Hester, I think this is your first webinar, so welcome to the digital space, and over to you, and welcome to the CIFSA platform. Thank you, Hester. Go ahead, take it away.
Thank you, Mark. Much appreciated. Good day, all. Welcome to my first webinar. I hope it's going to be okay, and that you're actually going to enjoy what I've got to say today. Just something quick. We've got a Eskom power outage on our side, nothing new, just adding some excitement to my first experience, but we have got some extra generation going, so I hope it's going to last for the hour. Just something about Agile Business Integration very quickly. We actually specialize in ISO management systems across the globe, and some awareness training in terms of health, safety, and environmental management, and that is just in a short. But that is not what you're here today to hear. I think the topic that we're going to address today is hopefully going to be of some insight to you and beneficial. This topic has been quite having the industry in total panic. We hope I can remove some of the sting out of the panic today. And let's see why we have to do this COVID reporting and how do we do it, and where from here, and how we can support you. The government has published on the 28th of September, they've published a guideline in terms of the reporting of COVID-19 information and data. And why do you think we have done this? Or why have the Department of Health have gone this route? I think you will agree up till now, all the statistics that we've seen in social media has been rather a thumbs up. There's no factual evidence on any of the statistics that has been published today. And I must say, I'm very impressed of the committee and the team that has put this portal together and asking industry to participate positively to report on COVID-19. The reason being is that we have to have factual data, okay? So the whole presentation will go about and is about how we and what we need to do to capture this data. So the whole presentation today is going to be about the purpose, the scope, the categories of data, the submission process, which I think that is where the big panic lies, the protection of personal information, and also give you some support in terms of templates and forms that you might use. We will leave questions after the presentation, so if you can bear with me during the presentation, there's a whole question category after the presentation. Is that okay? The whole purpose of this COVID-19 online portal that government has developed, and I must say it's very user-friendly and quite attractive, is a model that they've built to monitor the monitoring working in various economic sectors. And that includes all departments. It includes private sector, public sector, governmental sectors, everybody that has got 50 or more employees can actually log in and report on their data. It also provides a platform for dynamic data analysis. You can imagine up till now, the various platforms and the various mechanisms and the various vehicles that they had to deal with to collect data and to make sense out of this data. Now the data is structured, it's formatted, and they can actually do factual statistics on it. It is also to do early identifications of hotspots. Where are our hotspots? They cannot, and then they can go and zoom into those areas and provide assistance. It's not to victimize those areas. It's not to pinpoint those areas. It is the main purpose is to provide the necessary support to those hotspot areas. Evaluate the impact. If Gauteng is the major area or geographical area that is impacted by the COVID-19, they can also provide the necessary support. If you've got factual data, you can actually make meaningful business decisions and national decisions on their data. Also determine the human resource and the economic impact that it's got. Providing regular updates, identification of key scientific questions requiring further investigations. You will see once you've logged in, you actually become part of a group that you can pose questions, and there's a whole support function behind the portal that they have developed. Who needs to do this? Employees that has got 50 or more workers at a workplace. Now, this is as any other law or act or any other directives that we received up till now, you will agree that there are many gray areas and there are many questions, and we need to challenge those. One of those areas is the definition of a workplace. What is a workplace? In my definition and in my opinion, it can be different addresses. If you take, for example, the mining industry, one mining company can have 2,000 plus employees, but they are at different sites. So each of those sites needs to be registered and needs to be monitored individually. If you've got a retail business and you've got different branches, then each branch needs to be registered. So for me, a workplace is a specific address. It's not company-based, it's a specific address. So if company A has got 3 branches, the first branch has got 9 employees, the second one has got 52, and the third one has got 40, then you only need to register the one branch where there are 50 or more employees. Also, it is to report on positive tested cases, and it applies to, like I said before, it applies to local, provincial, and national levels of government as well. And this whole point is that we will now have, or now got the opportunity for a single entry of data submission. And it's not all over the place. It's not in different formats. It's not in different structures. It is all in the same structured format. Sorry, guys. Whoa, now I'm going the other way around. Okay. The categories of data, what must we report? Okay, the first thing we must report is on vulnerable worker data. Who are our vulnerable persons? Now, the information that the Department of Health is requesting is nothing new from level 5. If you have not complied to the COVID-19 monitoring and evaluation and screening process from level 5, you might have difficulty in reporting the data, and you might put in extra work and extra effort and extra energy to compile this data, because this data that they're asking for should have been in place from level 5 already. So from level 5, in terms of the different directives, you should have identified your vulnerable persons, and you should have had a work plan in place to manage those vulnerable persons. Then you were supposed from level 5 up till now, it's still a legal requirement to do your daily symptom screening. So what they're now asking is that you actually capture this data weekly before Tuesday for the previous week ending Sunday. Now it sounds complicated, but they're giving you the Monday and the Tuesday to prepare your data for the previous week that ends on Sunday. So all the data should be available in any case. Then you've got your COVID-19 testing data. That is only where employees are symptomatic. Also within the calendar week, reporting by Tuesday for the previous week, Sunday, and that needs to be supported by laboratory test that is compulsory. Then you've got your high exposure risk workplace contact tracing. That is the total of number of employees placed in quarantine as a result of the high risk exposure. Same time frame for reporting. Then you've got your post-infection outcome and return to work data. Also, that is for submission only once the employee returns to work. So that's a once-off. So your vulnerable worker data is a once-off, and your post-infection outcome is a once-off. The other three categories are weekly reporting that you have to do. So what must you do? Where do you start? Well, you have to start collecting data. Now the portal is predefined with predefined data categories that you have to complete. And it's actually very user-friendly. It's not complicated, and it takes you through the whole process. However, to be able to capture the data online, you must have your data almost as a mirror image to the portal data that needs to be captured. Otherwise, you're also going to struggle with your weekly reporting. I've put on the screen, you have to register your business at first. So that is very critical. It is a very easy process as well. I just need to find my document. So when you register your company, it asks for very basic information. What is the company's registered name, the registered number, and which industry you fall in, and then it's got a breakdown of your human resources. Remember now that registration is per work area. So if you've got multiple work areas, you will have to register each work area that has got 50 people or more per work area. Then the system will generate a unique ID for you to log in every time when you go into the system to actually capture your data. Then you've also got different applications that you can choose how you want to import your data. There are Excel spreadsheets. If you submit your Excel spreadsheets via email, that's another option. Or you can upload your Excel spreadsheets. And I'm not an IT boffin, but the IT people will understand the CSV data files. All that can be automatically uploaded and transferred into your weekly reporting because it's in a structured format, mirror image to the portal screen that you have to update. Each employee shall be allocated with a unique identifier, which will permit linkages across the different categories. For example, if you registered the employee as a vulnerable person, it will have a unique category. If the person falls ill and you register that person as being ill, it will link it automatically. So they've put a lot of integrity and intellectual properties into the capturing of the data and the management of the data and linking and manipulating the data. All data, this is quite a hot topic at the moment. People and industries and employees are extremely nervous in terms of the confidentiality of employee information. And I don't know if you all heard about the POPI and the PIA Act. Government has given us the assurance and the reassurance that all data that is submitted will strictly adhere to the POPI Act requirements, and they will treat all data with the utmost confidentiality, and they will only disclose employee information and data that the industry captures as required by law. Then once you've registered and once you are in the system, they actually have created support groups via email. So you can pop a question or you can ask for assistance, or the groups actually share information regarding a specific topic or a problem that you've got. And the response time to that is actually quite impressive. So you're not on your own, you're not left behind, and you don't have to sit there and stress as to how you're going to manage this big elephant. All employees must be aware of the information being submitted to the NIOH, and record of that communication must be kept on file. The directive is very clear that you have to tell your employees that the information is now captured on a national database, what the purpose of that is, and what the security measures is to ensure that the information is kept confidential and secure. There's just a screenshot. Once you've linked onto that link, onto that hyperlink that they've given us, this is the screen that you will get. And it's very simple. You click there, click to register, and it will actually take you to the first screen whereby you register the company. You will receive an email with your user ID and access password, of which you will then keep confidential and not sharing that information, whereby you then will enter your data. Once you've registered the business, there are different levels of access that you then do to capture your data. For example, there's a vulnerable person section, and then your screening, etc. So it will take you through the process. What I need to tell you is once you have captured the data, what people are stressing about, especially the weekly screening, please remember, let's go back. On your daily symptom screening data, it is only for where the employees are symptomatic. So if you've got 2,000 employees, you're not going to capture 2,000 employees access screening onto the system. You will only capture the employees that are symptomatic. Symptomatic in terms of, have they got a fever? Do they cough? Have they got a headache? Have they got red eyes? All the normal COVID-19 known symptoms. That is the only time you will capture. If you've got 2,000 employees, please don't submit 2,000 employees data weekly. If you've got 2,000 employees, if you've got 2,000 employees and 3 has been symptomatic the previous week, you will only capture those 3 employees on the system. Okay. If you've got a high risk exposure, the total number of employees placed in quarantine. If there's 5 people that's been placed on quarantine the previous week, then you capture the 5 people the previous week. And if a person has been tested positive, has been tested positive for COVID, then you will actually capture the data and you will only capture that individual's data. Once the person has returned to work, then you will report that the person has reported to work, and it's got predefined fields that you have to capture that they ask you certain questions on. And it's very, very basic questions. It's not complicated. There's nothing out of the ordinary. But if your data is not structured, and that is where the templates comes in, because if you capture the templates actually can provide you with an easy mechanism to transfer that information into the system. What a lot of companies has done is they've actually started employ students for this period. And they actually let the students for big companies, I'm talking big companies like mines and big industries, where they actually employed students, give them a crash course, and they actually capture the data on a weekly basis. And remember, you not always have every week symptomatic employees or somebody that has got COVID-19 cases. I think the big panic came into the industry is where a company has got 500 employees and they must capture 500 employees' data on the portal. And that's not the idea. That's not the purpose. If one person out of the 500 had symptomatic signs, then you will capture that one person's data. So the volume of data that I think created the panic in the industry is not entirely true. However, if you've got 50 people that are symptomatic and 40 have to be put in quarantine for the previous week, obviously there's a bit of data capturing and data collection that have to be reported to the Department of Health. And I think that is basically what this whole thing, the information session is all about, is to say, please do not fear, please do not panic. It's not about the volume, it's about the isolated cases where people are symptomatic, tested positive, placed in quarantine, and returned to work. All right.
I've got two questions here, one from Martin Ruiz and one from Rob Allen. The first one from Martin Ruiz is, we are 70 employees, but we are all working from home. Do we need to submit data?
No.
Okay.
If you work from home, because it's a single workplace, that is where I say that the workplace definition has not been clearly defined.
Excellent.
And so then, workplace, if you're one person, then you don't report. The holidays where there are groups of 50 and more, your risk to be contaminated or contain the COVID-19 is bigger, according to the medical profession. So they want to know for any workplace 50 or more, what is the status of that workplace on a weekly basis. Working from home, singular person, don't have to capture.
Excellent. Esther, the second question is from Rob Allen. If employees refuse to give permission for their data to be shared, then should the employer just submit data as unknown? Given the security issues that occurred with TERS and the ability to see sensitive information of employees from other companies, I think it's perfectly reasonable for employees not to have confidence in the promised security measures that are in place. Do you have a response to that?
I understand the employee stance, and I understand the uncontrolled situation of information in our country and cyber attacks and sharing of information, etc. If an employee do not give consent to provide the information, I will have a discussion with those individuals and try and motivate them to positively participate to the process.
Okay.
But the employer can't enforce it, unfortunately, because the employee still has got the right. As long as we don't use that now as an excuse in the industry not to support the Department of Health with a positive endeavor to collect factual data.
Okay. Thanks, Esther. I've got 3 more questions here. One from Ezekiel Moloedi. I have 9 business units, all housed in one head office, and our operations are in different companies in all provinces, labor broking. How do you respond to his situation?
Then again, it's workplace related. The directive says where you've got 50 or more employees at a workplace. So if you scattered all over the country and your numbers per workplace does not exceed 50, then you don't have to report.
Okay, excellent. So one more, I've got 6 questions here, and I think let's take a few more. One from Alison Willemse. Good morning. Does the portal allow for 2 people to record information? Example, HR would report on vulnerable data and HSC on weekly screenings. Would the one be able to view the other's details?
You can, which is not advisable because of the security factor, because you can only get one user ID and password per user. And you can't register multiple users per business entity. There can only be one user per business entity, unfortunately.
Okay.
You can, and please don't, I'm saying this unofficially, you can share that user ID and password with other employees, which obviously from a security point of view is not advisable.
To everybody out there, we will be sharing the presentation, and we will be sharing Hester's contact details. I see 1 or 2 people have asked for contact details. We'll be in touch with everybody to provide Hester's contact details to you. So if you do have any other questions, please feel free to email her. Just a couple more. We'll take live, Hester, if that's fine with you.
Yes. Mark, I just also want to mention these 4 templates that is available to the industry as well, which is structured according to the screens and the fields. It's identical to the screen. So what a lot of companies do is they capture it on the Excel spreadsheets and they upload the spreadsheets also into the system. But the volumes are so small. If there are multiple volumes of data that needs to be captured, I'm going to be a very concerned South African citizen.
Absolutely, absolutely. So following that, let me ask you this question. Our employees refrain from coming to work when they have any, he emphasizes any COVID-19 related symptoms. Surely other companies do the same. What is the use of the database at that point in time?
It is only an endeavor for the Department of Health to determine what is our actual COVID status within the country. They've used other mechanisms, which has just resulted in a complete thumbsuck. This is now actually captured, structured data that you capture online on the portal, which they then can draw statistics at any point of time for any period of time. Okay. And then they can make decisions on it. They can then decide, what do we need to do? What is the way forward? How do we stop this? How can we provide the necessary support? I just see it in a very positive light and not in a negative light at all. I know there are people that is very wary and has got a lot of negative questions about this whole online capturing initiative from the Department of Health, I can just see some positive things come from it, because now it is factual data. I myself has criticized government on the statistics that's been provided to us up till now. I think this will give a much stronger baseline to base their reporting and informing the citizens of South Africa what is actually happening in our country.
Thanks, Esther. So for vulnerable data, do we only capture employees with comorbidities? That's the question.
Well, the vulnerable person has got a very specific definition in terms of the published directives. And that is a person that is 60 and older and has got any chronic medical condition. And that is quite a wide spectrum.
Okay.
It can be from heart disease or a heart problem to diabetes to asthma, and the list carries on and on and on. So it's 60 and over and any chronic medical condition. So if you don't know your vulnerable persons in your company, you actually are at high risk, because that's the first submission also that you have to do, is to say who are the vulnerable people within your organization.
Okay, Hester, I've got two questions here, both around numbers, branches, etc. So maybe we'll just have to emphasize this one. So one is from Anonymous. So if I have a branch that is less than 50 employees, then I don't need to register the branch. Is that correct? Yes or no?
Correct. Correct. You register the work, because remember that the registration, if you go into the portal, the registration has got a work address. So, you know, I capture data on behalf of my customers. I've got a client that has got a head office and 3 branches. I've registered all of them at different addresses, and each one of them has got a unique user password and user ID, because I have to report per workplace. And I think that is where the confusion comes in. It's not per company, it's per workplace. Okay.
So I'm just going to tackle 2 questions in one here. I think you've been very clear, but let me just read them to you anyway. We have 30 employees at one site and 30 employees at another. They often move between sites. Must we still report?
No, don't have to report.
Okay, then the second question is, hi, it's Marius from Prevail Engineering. We are 55 people in total, but we work 2 shifts, so we are never 55 people in one place at the same time. Does that mean we still have to report?
The directive does not mention shifts, okay? However, if you if we go back to my slide in terms of the high risk, sorry, let me just do this again. The second last bullet, high exposure risk workplace contact tracing, total number of employees placed in quarantine. If they're working 2 shifts, it cuts the number of 50 down. I don't know what the number of the shifts is, but if each shift is less than 50 at any point of time, I will also not report. To me, it doesn't make sense, because you're not sharing the same workplace for the same period of time, which increases your risk of contamination. Does it make sense?
Okay, I think if people have further doubts after you've explained it now, I think they should contact you directly. Once again,
they might well come to contact me, because there's a lot of misunderstanding, and even we try to figure out in terms of certain things which they also can't always answer us. And that is where the email groups on once you've registered is also very, very nice, because all these questions goes back into one system whereby they can look at all these questions and then address them. And if there is a certain trend of a specific question, it also helps the team behind the scenes to address those questions and to making sure that we're all on the same page and understanding what exactly the definitions and the requirements are. But for me, different shifts less than 50 do not qualify for reporting.
Okay, excellent stuff. So a question is coming from Gil Kennett. Do you have to define what an employee's comorbidity is in the report?
Sorry, Mark, just repeat that for me again.
Do you have to define what an employee's comorbidity is in the report?
Yes, you have to. You have to say when you capture the vulnerable person's data, you have to say what the person's status is. Are they over 60 or what chronic disease they've got?
Okay, excellent.
So you have to declare the person's vulnerability.
Okay, excellent stuff. So I've got two more questions here. I think we'll take those two last questions as that it, and then I'm going to refer everybody to talk to you on email after this, Esther, if that's fine. Okay. So from Michelle Cronier, she says, simple question. If an employee displays COVID-19 related symptoms prior to entering the company's premises and sent to seek medical care, who is responsible to pay for the COVID test should they need one? I know it's not related to the webinar. If anyone could just email me the answer, thank you in advance. Do you have a short answer there, Esther?
Well, the directive in terms of the cost, it's very complicated and it's not always straightforward. It depends what the company's policy and procedures says. Because it depends whether the person was contaminated in a personal capacity, or whether the person is suspectedly being contaminated at work. Now, there are various government testing stations available. So what the industry in norm that I deal with, that they do is if the employee do not want or hasn't got the funds to pay for those tests, they can make use of any nearby governmental stations to be tested. It's very difficult to upfront determine whether the person was contaminated in a personal capacity or from a work environment scenario. So the rule is, or the norm rule is they go and test at their own cost, and after investigation, the test will be refunded to the employee pending on the outcome of the investigation.
Okay. Excellent. And then just a last one from Wynand van der Merwe. In accordance of information, our employees of personal information be disclosed. How do we as a company rescue our employees that reassure our employees that their personal information will be protected? I think you mentioned something earlier about this.
I unfortunately cannot give the industry that assurance. In the directive that has been published on the 28th of September, the government has given their commitment to comply to the POPI and the PIA Act, and that they give their commitment to secure the data and to keep the data confidential. I don't know how, I don't think anybody can guarantee that from outside the portal environment. It's all IT related. We just have to trust the Department of Health that this information will be used as promised by us by the publication on the 28th of September, that they will use it for the right reasons and that they will keep it secure.
Esther, thank you very much. I think firstly, Esther, can you just give everybody your email? Just read it out so that people know. What is your email?
Okay, it is Hester, Hester, at Agile, Agile, hyphen, or a dash for those that don't always understand the hyphen, and BIS, B for Benny, is.co.za. So it's Hester at agile-bis.co.za.
Excellent. So for everybody who's attended this morning, thank you very much. What we will do from our side is Zoom gives us a list of everybody that has participated in the webinar. We will email you all the templates and the presentation and include Hester's email address on that. So if you do wish to contact her directly, you will be able to do so and ask Hester any other pointed questions you may have. But for the moment, we will sign off. Hester, for your first webinar, you've done fantastically well. Thank you very much. And everybody who attended today, thank you very much. Please have a good day and hope to speak to you soon and ask Hester a lot of questions. Okay. Thank you very much, everybody. Bye-bye.
Thank you, Mark. Thank you. Bye.
Bye.